All right, today we will be talking about the heart. So let's get into it. So first off, we have the the two blood vessels of the body. We have the artery, which is it carries blood away from the heart, and we have the vein that carries blood towards the heart. All right, so next we'll talk about the base and the apex of this heart. So this is the base, this is superior, and this is where major blood vessels emerge from. And then we have the apex, which is inferior, and as you can tell, the tip points left a little bit. All right. Next, we're going to talk about the auricles. They are pouch-like extensions. I kind of cut them off from previously dissecting this, but they will expand when blood is in the atriums. So, and then next we'll talk about the brachiocephalic trunk. So that would be up here. And this importance supplies oxygenated blood to the upper region of your body, so that would be like your neck up. Next, we'll talk about the vena cava. So you're going to have your superior, inferior. Obviously, it is not on this heart. It has also been cut off. But your inferior vena cava, which is the largest vein in the body, it carries deoxygenated blood from the lower extremities, and then your superior vena cava carries deoxygenated blood from the upper extremities back to the heart. So yeah, next we'll talk about the aorta. The aorta is the largest artery in the body. This carries blood from the left ventricle to the rest of the body through the systematic pathway. So that's the importance of the aorta. Okay, so next we're going to talk about the right atrium. The right atrium receives deoxygenated blood from the body, and then the right ventricle down here sends that deoxygenated blood to the lungs. And then over here with the left atrium receives oxygenated blood from the lungs, and then the left ventricle sends that oxygenated blood out to the body. And so what separates these two, the ventricles and the atriums, are cusps. So on the right side, we have the tricuspid valve. It's an AV valve. As you can see, it has like those three little bands. And so this just helps prevent backflow into the right atrium. And then same thing over here, we have the bicuspid valve, and it kind of got cut apart in my lack of dissecting abilities. But that same thing, it separates the ventricle and the atrium on the left side here, and it just prevents backflow to the left side. Okay, so the next thing we're going to talk about is the chordae tendineae. Those are these little tendinous tissues right here. They are attached to the cusps, and then also they're attached to the papillary muscles. You can see those little things right here. So the papillary muscles are these little things right here. They're obviously attached to the chordae tendineae, as just mentioned, but their main purpose is just to make sure that the cusps don't go into the atriums. And then next we're going to talk about hopefully I don't say this wrong, trabeculae chordae. Those are these little these tissue bands that are attached to the inner walls of the ventricles. I don't know if you can see them down there. So those are those. And then we have the ventricle septum. Excuse me. This thick wall of muscle separates the ventricles. So that is this thing right here. And then one thing I forgot to mention earlier when we were talking about the valves was the semilunar valve. I kind of cut it off due to my poor performance on dissecting, but that separates the left ventricle and the aorta. And then one last thing is the coronary artery. That is an artery that runs on the outside of the heart, And it does have other arteries that come off of it, but the main purpose of it is to supply blood to the heart.